Hi guys, my name's Emma. I'm a fourth semester nursing student in an associate's registered nursing program, and today we're just going to be talking about the layout of nursing school, what to expect going into the program, and what to sort of understand before getting started. Whether you just got accepted, you're thinking about it, you're in your first semester, this video is for you. Let me know if you guys have any questions or anything else. Please comment below if you're new or if you're just starting. I would love to hear from you guys. My email will be attached as well if you guys have any questions. Alright guys, let's get started. Alright, first we're just going to talk about what to expect going into an associate's nursing program. So first off, when I graduate, I will be, once I graduate, get pinned, pass the NCLEX, all the things, I will be considered a registered nurse. I think that was one thing sometimes people were confused on because they're like, oh, you're an associate's program, so is it LPN or what is it? The program I am in is considered a registered nursing program, which I'm thankful and excited about. But for this program, it was 2 years, consisted of 4 semesters. So with that being said, there's, depending on each semester, there's different things, which we'll talk about each semester. But one thing going into nursing school, I will say, is that I felt myself pressuring myself a lot to be okay, you have to get a certain grade on tests. There were some tests we had to get a 90% on. One of our dosage calculation tests, you had to get 90% or higher in order to continue out throughout the semester. And you had another chance in case you didn't. But it was scary because it's even if you didn't do it high enough for 90% on the first try, then you would have to try again. And if your second attempt wasn't higher than a 90%, then you have to repeat that semester. That's how our program worked anyway. So with that being said, and we'll talk about repeating as well, repeating a semester, but there were certain tests that you had to get certain grades on, or with skills check, which we'll talk about here in a second. Skills checks, you only had 2 chances as well, which I noticed myself being okay, I'm so nervous, I'm gonna mess up, I'm gonna fail, which it's very easy to get in that mindset, oh my goodness, I'm gonna fail, I'm not gonna pass. So things you're so nervous, but it's okay. Just keep trugging along, and it'll be okay. But that's one thing we will talk about. So within the first semester, we had checkoffs, which are things that you go over your skills. You'll be taught skills whether you watch videos online or you watch your professor do it in person, and then you have time to practice. So skills that we did in first semester were things like vital signs, physical assessments, wound care, and then we also learned how to give oral meds and IM injections and subcutaneous injections. Those were our 4 checkoffs we had in first semester. So with a checkoff, you have a professor or a skills check, whatever they may be called in your program, and it may be different for each program. I'm not exactly sure, depending on how different states do it and whatnot. But for us, we had a professor who would watch us perform this skill, and we may do it on a mannequin. So we'd have to walk and be hi, my name's Emma, I'm gonna be your student nurse today. I'm gonna provide privacy, gonna put on hand hygiene. We'd have to walk through what we would do in an actual situation in an actual patient's room. And then we would perform the skill. So say giving meds, we would have different stations where, okay, you're going to give an oral med here, and then you're going to give so many. You may have to do liquid form, so many PO pills, and then you may have another part where you go and do an IM injection or SQ injection, that sort of thing. So you would have a professor who would watch you, and he would be okay, you missed this, or okay, you did good, you pass. But for us, they wouldn't tell us when we would miss something. So you'd have to practice on your own before you go into the checkoff. Me and my friends would go into the lab and practice for it felt for hours to make sure we had our skills perfected. Especially in first semester, I feel we practiced a lot more just to make sure we knew what we were doing. So with checkoffs, don't get too nervous. I didn't really know what they were until we got started in the program. They're don't let checkoffs freak you out. I'm what's a checkoff? What are you talking about? But yeah, that's what a checkoff is. A professor watches you, make sure you can perform a skill accurately, and we had 2 chances. So if you didn't get it right the first time, or you missed multiple things on the first try, then they would have you do it again. But with that being said, if you didn't pass it the second time, for us, you would have to repeat that semester. which is a little scary. That made me so nervous. I was so nervous for checkoffs. Every morning I felt like I couldn't sleep that night and like I couldn't eat before it. So if that's you, it's okay. Eventually you'll be fine. You'll like get through it and you'll pass and you'll be fine. I did have to repeat a checkoff. It was my IM injection checkoff. I forgot to put on gloves. I was so nervous that I forgot to put on gloves. But other than that, I have not had to like repeat any other checkoffs. So they're not horrible. Just practice, know your stuff, and you'll be fine. So in nursing school, you'll have different clinicals. You may have hospital clinicals, you may have community clinicals. The difference between that is that hospital clinicals, you'll like have an instructor with you and they'll watch you maybe do a skill for the first time. Say like physical assessments. They may watch you go do a physical assessment, make sure you're doing it right on a real patient, and then if they feel comfortable and know that you're doing it well, then they'll be like, okay, you're good to go do another physical assessment, like on your own. And then so that's the difference between hospital clinicals. You'll have an instructor with you, watching you give meds, watching you do skills, helping you hang blood, but you may also be assigned to a nurse at that time too. So that way you will like take a patient of that nurse's patients and take a patient and then like focus on them, and you may have like paperwork. We had a lot of paperwork we had to do in clinicals. So be prepared for that. It just helps you put everything together and be like, oh, that's why their potassium's high, or oh, that's why we gave this medication, or oh, that's why they have crackles in their lungs, that sort of thing. And then for community clinicals, you will not have sorry, my paper fell. You will not have an instructor most likely with you. For us, you like went there on your own individually, and they're like a clinic site. So you may go to like an ER, you may go to an OR, like surgery. You may go to a disease management clinic, cardiopulmonary place. There may be different places that you go, pediatric unit, that sort of thing, that you go on your own just to get a feel for the different branches of nursing and healthcare, so that way you can be like, oh, I loved home health, or ooh, I did not like OB, was not my thing. So depending on what semester you were in, our community clinical sites did not start till our second semester, and then we had our community clinicals. So yeah. And then our hospital clinical hours did increase from first to second. First semester we just had 4 6-hour clinical days, and then in second semester we had 6 12-hour days, and then we had like 6 community site days. And then that was about the same for third semester. And then for this semester, for fourth semester, for us anyway, we have like an internship that we did 2 interviews last semester. We had to choose 2 places, and then we did 2 interviews with their managers. And then we would get an offer. If they thought we would be a good fit for them, we could get an offer to do an internship with them for our fourth semester. We will follow a nurse on our own and observe them. We go with their schedule, and then we observe them, and then if the managers and whatnot think we're a good fit, we could get offered a job. For us, that's called like a capstone, internship, practicum. There's different names for it, but that's what's happening for our like hospital sites for fourth semester. So there's a bit, I feel a little pressured because I'm like, okay, I need to make sure I do a good job, because like you want to get offered like a job. It's called like a contingency hire. So that's something that I notice I'm a little nervous about, but I'm excited for too. I'm going to be in an internship at an ICU, so an intensive care unit. So that's where I'm going to be doing my internship this semester. And depending on how it goes and if it feels like I'm a good fit there, I could get offered a job after the practicum or internship or capstone, whatever you want to call it, is finished. So yeah, we'll see how it goes, and I'll keep you guys posted for sure. But and I'll give you guys updates on things that I like think how the internship and stuff is going, and tips and whatnot. So yeah, those are some things that I would say, like for clinicals, for hospital, and for community to be aware of. We had like skills bags that we had to order, a part of like our books and stuff that we had to order, and they had like different things in it. You will have to order your own. For us, we had to order our own stethoscope, but they did provide like pin lights for us. They did provide like the scissors that like cut gauze. I don't know the correct term for it, but the scissors that cut gauze and stuff. So with that being said, they did provide us with some of the materials that we can take in to the hospital with us. I actually have my skills bag here right now. So this is sort of what it like looked like. And then in it, it was just a big bag, and we got one each semester, but like we would just add stuff to our bag. So like you may have, some of it has my stuff in it, but you would have stuff that like for your CVAD, that was like third semester. You may have like a Foley kit, that sort of thing. So that was something that I was not aware of, is that we get our own skills bags, and it comes in with skills and materials that we will perform during our checkoff. So yeah, that's a skills bag. And then, hang on, I had a note, but it fell. Okay, people. So 2 years, 4 semesters. We talked about checkoffs. The professor watches you. Clinicals. We talked about hospital and community. Again, community sort of just gives you like an opportunity to see different types of nursing, so that way you get a feel for what you like and what you don't like. You may have paperwork with those too. We did. It wasn't as much as hospital paperwork, but you will have paperwork. You'll learn to chart too, like on the computers in hospitals, that sort of thing. Give yourself grace if you don't get it the first time. If you don't get it for like the first 5 times or whatever, it's fine. You're new. You're trying to learn everything, and give yourself grace. Even now, I'm like, okay, I forget how I did this, or oh, it's been a few months, or oh, I don't remember, or blah, blah, blah. And then I get hard on myself, and it's like I start beating myself up. Like, okay, so I feel like I'm not like smart enough. I feel like I'm not good enough, or I don't remember this, or I didn't chart this right. And it's like, it's okay. Take a deep breath. You're learning. And even once you become a nurse, and even if you make mistakes, or even if you forget something, you have a healthcare team. Rely on them. Ask them questions. Ask more seasoned nurses. They may know questions that you may not know the answers to. It's okay. Lean on each other, and it'll all be okay. And then during nursing school, something else is that you may have like simulations. We had online and in-person simulations. Online, we would have like a scenario where we would have to take care of a patient, like a mannequin online, basically. You may have to redo it a couple times. I did. I had to redo the simulations sometimes. You had to get like a certain percentage on that as well. In nursing school, there's a lot of like certain percentages, certain number of times you can take something, that sort of thing that you have to get in order to continue on. And then in person, we had simulations like where we had like a neuro simulation. So we had a patient who like had a stroke, and we had to like take care of them. And there were like 5 or 6 students in there, and they each like, one person got a primary nurse role, someone got like a med nurse role, someone got secondary nurse, someone had to like write down and be like the documenter. Depending on how your simulations work, we had like different roles that each person had to play, and then we would like flip-flop, and then one group would watch sometimes, and then one group would like perform, so that way we could get a feel for like seeing both ends of healthcare. So yeah, those are simulations. You will have like a scenario, like a patient scenario, and you'll have to go in there, you'll get like the history and the background and all those things, and then you'll go do a simulation in front of your professors, and then they'll like watch you work as a healthcare team, basically. So yeah, that's what the 2 years have consisted of for us so far. I'm trying to remember if there's anything else that I wanted to talk to y'all about. Yeah, grades, certain limit you have to like get, clinicals, checkoffs, 4 semesters. Yeah, guys, I'm not remembering anything else that I'm trying to think of. But yeah, eventually, I want to make what I take in my like community and hospital clinical bag. I will make a video of what all I got. Use your resources. That was one thing I would say that I wish I would have used more of, is like different online resources. But at the same time, don't overwhelm yourself, because I even asked a professor one time, I was like, should I like be getting these pharmacology like flashcards, or should I be like ordering this? And she's like, honestly, Emma, don't overwhelm yourself. We're like providing what you need to know in here in the program. And she's like, sometimes if you like get too many resources, sometimes there's so much floating in your head and you get overwhelmed. So use your resources as like sparingly, but don't cut yourself off from things you may need. So yeah, I'll post another video of like tips I found helpful and stuff too. Things that I did to study, things that I feel like helped improve my grades and helped me feel like I did better on tests. And it's okay to have fluctuations. It's okay to have tests where you go in and you get an 80, and then another test where you get a 90 something, and it's okay. Different materials gonna set different with you and your brain, and there may be some days where you studied a lot, and then there may be some days where you're like, I was working, and if you have kids, like I was taking care of kids, that sort of thing. Oh, one more thing I want to add. For healthcare experience, I would say going into nursing school, I did not have a healthcare experience. So that's one thing I wish I would have done maybe a little bit, is like become like a patient care tech before, or an STNA, or certified nurse assistant, CNA, medical assistant, whatever capacity you want to like go into. I would suggest maybe doing that beforehand, just because that's something I did not do. And I had family members who were like in nursing homes and in and out of hospitals a lot, so I feel like I had like secondhand experience, I guess I should say. I like was helping my parents from a young age take care of like family members, which gave me hands-on experience for sure. But I would say there's a difference between like helping take care of your family members versus like being in a hospital and actually like taking care of patients. So with that being said, that would be something I would suggest, just getting the feel for talking to patients, and understanding how different like orders are put in and how to chart. That was definitely a learning curve for me, was just the documenting. I don't like sitting at a computer and feeling like I'm having to like document everything, but that's something you have to like learn and get used to. So yeah. With that being said, guys, I hope this helped. If you guys have any questions, please reach out to me. Comment down below or email me. And yeah, it was good talking to you guys. Bye and good luck.